Hi, in this video we'd like to continue on the series of explaining late miscarriage cause and treatment. Now today's video topic is talking about the third most common cause for late miscarriage, which is short cervix. Now as the name suggests, it means that the cervical length is far too short to support a late pregnancy. Now during the second trimester, third trimester, we've already mentioned before that miscarriages during these stages are very rare because the pregnancy is very stable now and is slowly progressing towards labor. But when the cervix is far too short, there is a certain cervical length that is required. We are looking at more than 2 centimeters. Now, if you have 2 centimeters or lower far too early in the pregnancy, for example, you have your cervix is decreasing in length in the 20th week to 25 weeks, before 28 weeks, which is around 6 months and 7 months of pregnancy. This can potentially lead to premature birth or even much more outcome that we don't want is a pregnancy loss, because the cervix is far too short to support the pressure of the growing fetus, the expanding womb, and leads to this unwanted pregnancy loss. So a cervix is supposed to slowly soften and slowly decrease in length, but it should not be going lower than 2 centimeters. This is far too short, and it can be either congenital or acquired. So some women are actually naturally born with a shorter cervix than their counterparts. Now you can also get a shorter cervix if you undergo certain surgeries and procedures of the cervix. The most common one that we know of is a cervical colonization, where they remove cervical cancer tissues from the cervix so that they don't migrate upwards towards the uterus and then they spread aggressively. So these are the two common causes of a short cervix. You can talk to your doctor before getting pregnant. If you know you've been through cervical colonization, then you should actually seek out treatment. If you are worried that you might have a short cervix, you can actually request an ultrasound to actually measure the cervical length using ultrasound. And just by talking to your OBGYN doctor, they can actually accurately measure this cervical length and prevent this miscarriage from ever happening. If you have a history of late miscarriage, then you need to properly diagnose and actually get treatment. So how do we treat short cervix? Is that the logic behind it is very simple. We want the cervical length to be more than 2 centimeters. That is the cut-off point. As long as it's over 2 centimeters, then your pregnancy has a chance, very high chance of actually developing full term, and you can actually give natural birth. There won't be any complications of pregnancy loss or premature birth. So how do we do this? Is by actually placing 2 anti-cervical rings on the cervix. So this is the inner opening. We place one here, and then directly 2 centimeters below, there will need to be a 2 centimeter distance apart. We will place another ring on the outer orifice. Now this operation alone will actually lengthen the cervix, because the cervix is quite elastic, and it will give us easily a healthy range of 3.5 to 4.5 centimeters. This is the range that we want to look for. And if you have this cervical length, then the pregnancy is very stable. Pregnancy loss or premature birth is very unlikely. Anti-hospital offers this treatment as a full refund guarantee, that if you still miscarry after receiving our treatment, then we offer you a full refund. The benefits of our treatment is that we put 2 cervical rings instead of 1. A lot of hospitals will only put 1, which does not increase the integrity of the cervix much, still leads to a miscarriage. Furthermore, we don't use any stitches, so you don't need to be worried, because this operation does not need any stitches, so it won't lead to excessive blood loss or infection. We are simply securing it on the inner orifice and the outer orifice, allowing you to have a full-term pregnancy. Get in touch with us today if you'd like to find out more. If you know anybody who's experiencing these late miscarriages, they might be short cervix. Leave me a comment down below as well.